Welcome to Central US ACO's learning webinar on chronic care management. Everybody should have a login to the portal, our Central US ACO Health Endeavors portal. If you do not, please make sure to contact me or Becky, or one of your leaders, to make sure you are able to access and get a login. So let's go ahead. We're into the portal. Let's go ahead and log in. During this webinar, our goals are to understand how to maneuver through the portals, make referrals, complete the patient-centered care plans, and upload consent forms. So this is so we can kick off and really start using the portal successfully for our chronic care management. When you log into the portal, the first screen you come to, you'll go to the ACO Center, which is smack dab in the middle. We'll go ahead and click into that. Then we'll go into Beneficiary, Medicare Beneficiary Database. Within the database, when you search on the database, make sure that all your filters are over to the right. People are having problems sometimes with the filters not being to the right and not being able to find a patient. So make sure your filters are all to the right. This is a demo. This is not your database, so I can go ahead and email this to you. This is just this is a demo system. So when we get into the portal and you have everything to the right, you can click down and use your own NPI, your own physician's NPI, type in your physician's NPIs to understand your specific population instead of the population as a whole if you would like. So for right now, we're going to go ahead and search the entire database of the demo. When you come to the database, you see the headers across the top. We have action, HIC, first, last, DOB, stat, CCM, etc. So what we're going to focus on right now is the CCM. So the chronic care management. When there's a blue dot, that means Medicare has filtered. We have filtered these from Medicare's data, and everyone that has a blue dot has been successfully pre-filtered for you and is eligible for CCM. What this means is the eligibility requirements. They have 2 chronic conditions that will cause them decline or they will deteriorate over the next 12 months if not managed successfully. So that's what the blue dot means, that they're automatically eligible. You might find a patient that you know is a chronic care management eligible patient, but we don't have data on them. When a patient has a star and they have a little patient view patient claims tile next to the star, that means we do have data. If there's an I, that means we do not have data on that patient, but that does not mean the patient's not eligible. So if they are eligible, you could still do that patient. Okay, so we have a patient that is eligible. They have a blue dot, and within this blue dot, there is either a check mark or no check mark. When there's a check mark, that means that the patient is enrolled in CCM. In other words, you've already kicked it off. You've already started the chronic care management. The patient without the check marks means they're eligible, but we have not started chronic care management for that patient. So let's kick off and go into starting a chronic care management for this patient. You will click on either the I or the patient chart, which is right next to the star or the blue dot. When you click on that, it will bring you to the patient claims information screen. This is a high-level summary of all the patient's conditions, medications, office visits, hospital visits, anything that has been billed to Medicare. We know that this patient is eligible. They had a blue dot, and then it shows what all the chronic conditions are. We will list the chronic conditions to the left under patient chronic conditions. You will also be able to see where the patient visited, and if you hover over one of these, you can see where the patient visited, what kind of services they've received, in these little icons here, in the little grids. Or you can scroll down, you'll see patient data here. This particular patient looks like they were in the hospital. Here's the facility. $21,000. They were in the hospital for a few days. Lumbar problems. Poor fella. And so anyway, so that's part A, claims. But you can go in and view the individual claims, CPT numbers, what the diagnosis was, where they received their services. Remember, this is just a demo, um, a demo account, so none of these specific things are real. So we're going to go build a care coordination event. Let's go into at the top of the patient claims information. There's a scroll bar, so scroll down just a wee bit till you get to the care coordination event. Click on the care coordination event. This will take you to the care coordination screen. There is a timer running, but this is not how you track the time. This is just there to help you track. This does not record the time. In order to record the time, you must scroll down and go to CCM time. CCM time. You must put in the amount of time you're spending with the patient. Let's say this particular time you spent 10 minutes with this patient. Every time you do something, you must go ahead and chart what you're doing. So we'll choose one. We're doing a care coordination event. Julie over at the hospital is doing this event, and she had to call the patient to review diagnosis, issues, and meds. And she spent 10 minutes on that. So we'll just save that. All right, so it will take you over to a screen where you can see what Julie did. If we want to edit this event or we want to add another event, we could click over to that. It brings us back to the screen. And then let's review some of the things on this CCM. So here's a patient chart summary, which is the top button on the chart. It has a little green plus sign on it. In that, this will bring you back to, this probably looks familiar now, patient chronic conditions, tells you who the patient is, their HIC number, their date of birth, what type of, if they have Medicare and Medicaid. It will show dual eligibility if it's a Medicaid patient also. Again, you can go into the claims, you can see what's going on with the patient at a high level. You can see their medication list. This doesn't give the detail, but it does give you the medication list. It also gives you the diagnoses. All right, so I just wanted to point that out to you real quick. I don't know if everybody's gotten into that. Also, underneath the patient chart, there's a patient disease and wellness checklist. I think this is pretty cool because, let me open that again, sorry. In this is a summary of all the quality measures. If the quality measure is complete, there'll be a C. If it's incomplete, there'll be an I. If it's skipped, an S. A CNP is completed with non-performance answers. The non-performance answers and the I incomplete are the ones we need to make sure we get data on. So this particular patient has incomplete documentation of current medications was not done. All right, so that patient, we need to make sure that either we send out one of our care partners. In this case, it would be Integrity Pharmacy. We send them a referral, say, hey, go do a medication reconciliation. This patient is, we need to make sure that they're in compliance with their medication and we don't really have a good idea of everything they're taking. So also, if you scroll down, you'll see it's a wellness visit completed in the past 12 months. This patient has not had a wellness visit in the past 12 months. Sorry. Now, that would be a good indication when you start talking to the patient, you get them in and do a wellness visit for them so that can be billed out. In the wellness visit, you can gather all of the quality measures at the wellness visit. We have some templates made up that you can fill out and that will meet every single quality measure. It also tells if the patient has diabetes, and it goes into a lot of the other pieces of the quality measures. So I'll just close that up. All right, which brings us down to the templates. When we have a template, the first thing we're going to do is always, let's make sure that we mark our time. Now, if you're not marking it as you go along, you can go back and open a ticket to mark it. But this is how the time must be recorded. So you go to your CCM drop-down, click. You go to the CCM and put in your time. Okay, so this time we spent 20 minutes working on the patient. We had some referrals, we had to read some notes, we had to get some information from the physician, talk to the physician about this patient. We would document it all up here. Also, what we're going to do with the patient, we are also going to go ahead and do their patient-centered care plan. The patient-centered care plan is the care plan you use to start off the patient CCM billing. The first thing you do is after you gather the signature from the patient, the consent form, you go into the patient-centered care plan. The patient-centered care plan does not have to be done face-to-face. It can be done over the phone. So you've gathered the signature. In a perfect world, the patient came in, did an annual wellness visit. During the annual wellness visit, the physician or the mid-level said, we're going to go ahead and set you up for care coordination. Here's the form. We'll have our care coordinator, Julie, call you, and we'll start doing care coordination with you. Julie calls the patient, logs into the portal, and starts to fill out the patient-centered care plan. After the patient-centered care plan is filled out, Julie will make sure that she opens up and goes to the saved consent form, which will be saved in her computer, attach it to the file, and upload it. So Julie fills out all this information. During the time that she's doing the care coordination vet and filling all this out, Julie finds that the patient also needs to have medication reconciliation and medication management. At that time, Julie, our care coordinator, is going to go into the types of care coordination events, hit referral visit, pop up integrity to bring them over. Description, we're going to have we're going to ask integrity to RX visit and management. And we will send them an email alert that this will be happening. So you can also upload the referral form, and you can pre-fill this out. Let me see if I can find the quick referral there. Open that up, attach it. Or we can go in and do let's see here, a referral form on the portal. Here we go. Patient-centered care plan referral form. Have the demographics information, so you put the patient's name, their address, the start date. You want them to start this in the middle of August to go out and visit the patient. Contact referral, Julie Smith at OCH Evergreen, and Julie's phone number and the type of referral and RX. So we're asking their pharmacy nurse to go out and visit this patient to do a medication management for this patient. Now this patient would have to be a relatively, I would say, a high acuity patient. They're already a high acuity patient because they're in the CCM, 2 or more chronic conditions that are going to cause deterioration of the patient. So we know that it's a high acuity patient. Are they on a number of drugs, 5 or more medications? Is the patient confused? All this type of information you will get from your care plan. So what we'll do is we will go ahead and you do click send alert, but I don't want to send alert to them because this is just a faux patient that we're making, and save. So we filled out all this good information. We have a consent form. We have a quick referral. We sent over the referral for the patient. We can go ahead and log our 20 minutes for that month. The following month, our care partner is going to go out and log the 20 minutes for the medication management. Julie will get that back into the portal and see that this has been done. If there's any red flags or alerts that the nurse, pharmacy nurse sees, or contraindications of medications, they will alert you right away. They won't wait to put it into the portal. They'll call. So this is, in a nutshell, how the care coordination portal works. I want to show you one other thing, and this is getting a little bit more in depth. But in the care coordination portal, remember there's a number of different types of intervention templates that are available to you. So let's just take a peek at the hypertension. These measurements, these templates that are built are in here to help you. They're in here so that you can build out interventions, different types of interventions. So if you go into the blood pressure, the high blood pressure, or if you go into depression or COPD, we're going to be targeting COPD with some of our pulmonologists. So I'm going to look at this, chronic obstructive pulmonary disease. This is a big problem in our area. A lot of patients have COPD. So this will go through being able to log and categorize the interventions and things that are goals for the patient. And so we can understand exactly for this patient how they're doing. And we can start logging the success or the regressions that the patient is having. This is a tremendous tool. It's very powerful. With tools like this, we can start understanding outcomes. Outcomes are very important to population health management. Now, if anyone has any questions, please do not hesitate to give me a call. My phone number is area code 314-662-6911. Everyone should have my email also. It'll be attached to this video. If you have any questions, don't hesitate to let me know. Thank you and have a good day.